Good afternoon, ma'am. Good afternoon, classmates. I am Juberlet Dayan Baron, and our topic is all about common swine diseases prevention and control. So, for the terminologies, first is a pleuropneumonia. Is a disease of bacterial origin with a high respiratory impact. The production of toxins can often cause sudden death with nasal hemorrhage. So, a pleuropneumonia is a severe and contagious respiratory disease, primarily of young pigs 6 months olds. Although it is an initial outbreak, adults also may be affected. It has a sudden onset, short course, and high morbidity and mortality. It is also a severe respiratory infection caused by Actinobacillus pleuropneumonia. Clinical signs include the fever, anorexia, reluctance to move, respiratory distress, and sudden death. Then, diagnosis is confirmed by bacterial culture. Sick animals may be treated with antibiotics, but control is achieved by elimination of the bacteria at the breeding stock level. So, diagnosis of pleuropneumonia in pigs based on clinical signs and confirmed by serology or bacterial culture. So, treatment and control of pleuropneumonia in pigs. First is sick animals can be treated with injectable antibiotics. Second is elimination of the organism is the primary means of control. Next is actinobacillosis. So, it's caused by a systemic bacteria that affects many farms that have high health issues causing arthritis, pneumonia, or skin discoloration in animal of all ages. So, it is mainly caused by the bacterium called Actinobacillus suis, and in rare occasions by Actinobacillus equine. The first of these is present in most farms and lives in the tonsils of older pigs, and of course especially in sows. So there are symptoms. First is in sows. First is skin discoloration. Second is abortion and pneumonia and septicemia. Then for lactating piglets and weaners, these are the symptoms: the sudden death, high fever, pneumonia, skin discoloration, and skin lesions, not to be confused with erysipelas. Then arthritis, lameness, septicemia, and for the growers, it is the rarely seen and the same as in piglets. Then for the causes and contributing factors for actinobacillosis is first it can be triggered by PRRS. Then it can be infect the pig through the respiratory system or through cuts or abrasions. Then it spreads systematically and it can be found in various parts of the body, especially in lungs and joints. Multiple small abscesses are produced here. So for control prevention for actinobacillosis is the organism is sensitive to antibiotics, then strategic use of medication, then possible use of autogenous vaccines. Next is anthrax. In pigs is relatively rare and it may occur as sudden death. It can also take other forms of presentation depending on the location of the infection: pharynx anthrax, intestinal anthrax, or systemic anthrax. So, this is the uncommon disease of pigs in most parts of the world, including the EV where it is notifiable. It is caused by the bacterium Bacillus anthracis and is characterized by acute illness, fever, respiratory distress, and repeat death. So next is atrophic rhinitis. So it is an inflammation of the tissues inside the nose where the nose may become distorted or atrophy. So it is an infection disease of swines characterized by serious to mucopurulent nasal discharge, shortening or twisting as of the snout, atrophy of the turbinate bones, and reduced productivity. So next is Bordetellosis, Bordetella bronchiseptica. It's is a bacterium that can cause fever or pneumonia in pigs. If there are not complications and without the presence of toxigenic Pasteurella multocida type D, the disease has little clinical or economic consequences. So, Bordetelloses, it is a bacterium found in most, if not all, pig populations. Some strains cause a mild and non-progressive rhinitis that helps spontaneously. The disease is clinically and economically of no consequences. Next is botulism toxin. So, botulism toxins produced by Clostridium botulinum cause progressive flaccid paralysis, but pigs are very resistant to the toxin. So, botulism toxin is caused by Clostridium botulinum, an organism that grows in decomposing vegetables and produces toxins which are ingested. So, botulism is rare in pigs. It can be considered food poisoning. Next is brucellosis. Is a disease of bacterial origin with negative impact on reproduction performance. It causes disease, inflammation, and abortion. It is a zoonotic disease of significant importance. So, brucellosis is a venereal disease that infects pigs during mating. The next is Campylobacter. Campylobacter infection, although it is usually subclinical, mainly affects piglets causing diarrhea. So, Campylobacter are small curved rod bacteria which are present sometimes in large numbers in the small intestine and large intestines of most mammals, including the pigs. So, next is Clostridium difficile disease. So, it's characterized by diarrhea in piglets within first of a few hours of birth. So, Clostridium difficile disease is a cause of mild to moderate diarrhea in piglets during the first week of life. So, because the disease is toxin-mediated, diagnosis should focus on toxin and lesion detection. So, mesocolonic edema is commonly observed with C. difficile associated with disease in sucking pigs. Then, next is Clostridium noviae disease is characterized by gangrene and or cellulitis with sudden death. So, formerly known as Clostridium oedematians, is one of the group of clostridial bacteria that are usually present in the gut of the pig and are responsible for decomposition of the carcass following death. Next is Clostridium perfringens diseases caused by Clostridium perfringens appear as a chronic or acute enteritis in piglets. In some cases, growing and adult animals, you can also have a disease characterized by gangrene and or cellulite with sudden death. So, Clostridium perfringens diseases infection of the small intestine by type C strains or Clostridium perfringens causes a highly fatal necromorphagic enteritis. The next is colibacillosis diarrhea by E. coli. Affects mainly lactating piglets, causing high mortality. So it is an infection, one of the major diseases for swine industry, which is typically bacterial diseases caused by pathogenic Escherichia coli. It mostly causes illness and death in neonatal and recently weaned cause illness and death in neonatal and recently weaned pigs. So next is colitis. So colitis is an infection of the colitis. So colitis is an infection of the large intestine, mainly in pigs from 6 to 14 weeks of age. This is characterized by diarrhea without blood and with few or no mucosa. So colitis, means that inflammation of the large bowel. It is a common in some countries in growing pigs and is characterized by diarrhea. The next is edema disease. The edema disease happens during the weaning period and it is characterized by E. coli or K88F4 or F18 producing a very strong vascular toxin inducing sudden death, edema, and or nervous signs. So, also known as stereolosemic colibacillosis is an coli infection that is specific for pigs. Next is enzootic pneumonia or EP. The main issue associated with hypopneumonia infections is chronic respiratory disease. This pathogen usually amplifies the severity of other infections including flu and PRRS. So, enzootic pneumonia caused by Mycoplasma hypopneumonia is the most common respiratory diseases seen in pigs. So next is erysipelas. Erysipelas is a systemic bacterial disease characterized by diamond-shaped skin lesions and arthritis in its chronic form. So, erysipelas is infections disease caused by the bacterium Encapsulotrex rhizopathia seen mainly in growing pigs and characterized clinically by sudden death and fever, skin lesions, and arthritis. The fever can induce abortion and pregnant girls and sows. Then next is exudative epidermitis caused by the bacteria Staphylococcus hyacus, which invades damaged skin, causing cutaneous infection with eczema or humid dermatitis in lactating piglets and weaners. So, exudative epidermitis, commonly known as greasy pig disease, is a generalized or localized skin disease of piglets, characterized by exfoliation, sebaceous exudation, and formation of a crust that may cover the entire body. Next is Glasser disease. So, Glasser disease is caused by a bacteria called Glasserella parazoes, which causes polycerosities and sporadic arthritis in piglets and growers. So, Glasser disease, an infection disease of pigs, often acute, characterized by various combinations of meningoencephalitis, polyceriositis, and polyarthritis, as well as contributor to bacterial pneumonia. Next is leptospirosis. Leptospirosis is a disease caused by a bacterium that has affinity for kidneys and genital tracts. Can also cause reproductive problems. So, leptospirosis can be a serious reproductive disease of pigs that can also cause major non-reproductive illness in humans. It causes abortion, stillborn and weak piglets, and death soon after death. So next is listeriosis. Listeriosis is a rare systemic bacterial disease that can cause septicemia in piglets and can also cause reproductive problems in sow. So, listeriosis is a rare systematic bacterial disease that can cause septicemia in piglets and can also cause reproductive problems in sows. So next is Mycoplasma arthritis, Mycoplasma hyoscyanovia, and M. hyorhynus. So are present in most farms and cause arthritis in swine. So Mycoplasma are considered commensal microorganism of the upper respiratory tract and tonsils of pig. So next is Mycoplasma suis. Mycoplasma suis causes anemia and agalactia in swine, formerly referred as erythrozoonoses disease. So, Mycoplasma zoes is so far uncultivable hemotropic pathogen that causes acute or chronic infections, anemia in pigs. So, next is Pasteurellosis. Pasteurella multocida is usually the cause of pneumonia, a secondary infection to another respiratory pathogen, exotic pneumonia, PRRS, and flu. So, pasteurellosis is commonly involved in respiratory disease in pigs, and they may be toxin producing or non-toxin producing strains. Next is postpartum agalactia syndrome. This pathology consists of inflammation of the udder, mastitis, and inflammation of reproductive tract, metritis, resulting in a poor milk release or reduction of its production or agalactia. So, postpartum have also symptoms in sow. So, for lactating sows, loss of appetite, can have fever, mammary tissue is not well developed, and or it is reabsorbing. Then, it may show as an infection in the orogenital system and constipation. For the piglets, weak and starving piglets, then mortality in first few plays of life. So next is salmonellosis. So next is salmonellosis. So salmonellosis is an important bacterial disease in swine for its capacity to produce food intoxication in humans. Clinically, salmonellosis appears as diarrhea, systemic disease, or pneumonia. So, salmonellosis is a disease caused by any or more than 2,000 Salmonella serotypes. In swine, only a few serotypes cause disease, usually manifested as septicemia and or enterocolitis, sometimes by tissue localization of infection of various sites. Next is streptococcal infection is the most important streptococcus of pigs causing pneumonia, septicemia, arthritis, and encephalitis in pigs, and is also of great public importance for its zoonotic potential. So, it is one of the most important pathogen of pigs, causing mainly septicemia with sudden death, meningitis, arthritis, and endocarditis, mostly in post-wen piglets. Next is swine dysentery. Swine dysentery is caused by a spirochete called Brachypyra and causes severe inflammation in the large intestine, producing bloody and mucus diarrhea. So, swine dysentery is a severe infectious disease characterized by mucohemorrhagic diarrhea and marked inflammation limited to the large intestine. Next is tetanus clostridium. Tetany produces toxins that affect the central nervous system, causing hypersensitivity, stiffness in legs and muscles, and opisthotonoso. There are symptoms for tetanus clostridium. For all ages, it is hypersensitivity. Next is stiffness of legs and muscles, then tail, muscle, spasms in ears and face, high mortality, and opisthotonosis. The next is tuberculosis. Swine tuberculosis is rare today, but The most common is the Mycobacterium avium complex. Its importance lies in the fact that it causes nodules in the lymph nodes in the neck that results in the confiscation of carcasses in the slaughterhouse. Tuberculosis swine tuberculosis in pigs is caused by a range of slow-growing waxy mycobacteria. Next is Yersinia infection. The Yersinia infection is usually subclinical, although weaning piglets may have diarrhea. So, there are two species of this bacteria in the pig's intestine. Yersinia eudotuberculosis and Y. enterocolitica. They usually do not cause disease, but they have been associated with small problems in weaned pigs. Swine are an important source of human foodborne Neisseria infection. Then, next for the diseases caused by a virus. First is African swine fever. So it is very familiar. So African swine fever is one of the most important viral diseases in pigs. It is a systemic disease and is not notifiable on most countries. So African swine fever is a highly contagious viral disease of pigs. And its acute from the disease generally results in high mortality. ASF or African swine fever is a different disease to swine flu. The virus does not affect people and there is no impact on human health. Next is Eugiskis disease. So the Eugiskis disease is caused by a virus that can remain latent and causes respiratory, reproduction, and nervous problems. So it is highly contagious, economically a significant disease of pigs. So this viral infection tends to cause central nervous system (CNS) signs in young animals and respiratory illness in older pigs and reproductive losses in sow. So next is blue eyes disease. So, it's a viral disease that produces nervous symptoms, reproductive failure, and corneal opacity that develop in bluish color. So, blue eyes disease is the common name for disease caused by the porcine Reobola virus. So, that is characterized in nursing or growing pigs by central nervous system signs and frequently by corneal opacities. So next is bovine viral diarrhea viruses. So disease caused by two pistivirus in the same group as the swine fever virus. These viruses mainly affects cattle and sheep but can enter pigs farm causing reproductive problem. So bovine is an important pathogen belonging to the pistivirus genus Ploviviridae family, which comprises viral species that causes an economic impact in animal production. Next is classical swine fever. Classical swine fever is one of the most important viral diseases in pigs. It is a systemic disease and it is notifiable in most countries. So classical swine fever is a highly contagious and economically significant viral diseases of pigs. Next is Delta coronavirus. The diarrhea caused by Delta coronavirus is similar to porcine epidemic diarrhea but at a very low severity. So Delta coronavirus is the diarrhea caused by Delta coronavirus is similar to porcine epidemic diarrhea but at a very low severity. The virus damages the villi in the gall and thus reduces the absorbing surface, leading the fluid loss and dehydration. Antibodies from colostrum protect piglets. So, there are symptoms also in Delta coronavirus for sow. First is varies from child consistency similar to cow feces to very watery diarrhea. Then next is loose stools and vomiting. For nursing piglets, diarrhea, vomiting, dehydration, mortality can be high, especially in piglets less than 14 days old. Then for nursery and fattening, acute watery diarrhea without blood or mucus. Then low mortality and vomiting. Next is Ebola Riston virus. So, Ebola Riston virus is a very significant infection in humans. Of the 5 species of Ebola virus, Ebola Riston virus does not infect human but can infect pigs. So, Ebola Riston virus are stranded RNA viruses belonging to the family of Veloviridae. Riston virus infection occurred in pigs co-infected with PRRSV in the Philippines in 2008. Next is encephalomyocarditis infection caused by encephalomyocarditis virus found globally. Usually, it is of no clinical importance, but there are some myocarditis cases with high mortality of reproductive problems. So, it is a ubiquitous virus with a broad host range. Commonly considered a rodent pathogen, AMCU is known in the swine industry to cause acute myocarditis with sudden death in young pigs, abortion, and gestating animals. Next is enteroviruses swine. Enteroviruses are found in the intestine, although their clinical significance is questionable. So, it is stillbirth, mummification, embryonic death, and infertility are characteristics of reproductive disorders caused by enteroviruses in pigs. Next is foot and mouth disease. Foot and mouth disease is one of the most important vesicular diseases. So, it's a highly contagious viral diseases of many wild and domestic cloven-footed mammals and many other animals. In swine, the disease is characterized of viscides on the feet, snout, and in the mouth. Next is hemagglutinating encephalomyelitis. So, hemagglutinating encephalomyelitis disease only affects pigs less than 4 weeks old and is characterized by vomiting and wasting. So, it's a viral disease in piglets characterized by a vomiting and wasting syndrome and or encephalomyelitis. Although the virus is widespread, outbreaks are rare because sows pass protective antibodies during nursing. Next is hepatitis A virus. Hepatitis A has been identified in pigs with uncertain clinical significance, but it is very important viral infection in humans, mostly seen in the third world countries of Asia and Africa. So hepatitis virus causes asymptomatic infection in swine. Next is influenza. So, it's a respiratory disease of high importance due to its fast transmission and zoonotic potential. So, influenza is a respiratory disease of pigs caused by type A influenza virus that regularly causes outbreaks of influenza in pigs. So, swine flu viruses can cause high levels of illness in pigs herds that cause few deaths in pigs. Nipah virus disease. So, the Nipah virus is zoonotic, causing respiratory disease in pigs and mild to severe symptoms or even death in humans. So, Nipah virus disease, also known to cause illness in pigs and people. Infection with Nipah virus disease is associated with encephalitis and can cause mild to severe illness and even death. Next is swine pox. So, swine smallpox is a vesicular condition and caused by a virus and is mainly transmitted through lice. So, swine pox is transmitted most commonly between swine by the bite of the pig louse, Haematopynosois, which is common in many herds. The virus does not replicate in the lungs, but sporadic vertical transmission has been reported. Next is swine vesicular disease. So swine vesicular disease is not common, but its importance is based on its clinical presentation is distinguishable from foot and mouth disease. So swine vesicular disease is a viral disease affecting only pigs that was included in the list of disease notifiable to the IOE because of its similarity of its lesions to those produced by foot and mouth disease. So the next is PRRS, the Porcine Reproductive and Respiratory Syndrome. So PRRS is the viral infection with the highest economical impact in North America and many European countries. The virus causes reproductive problems and affects the respiratory system. So PRRS, it is a viral disease characterized by two overlapping clinical presentation: reproductive impairment or failure in breeding animals, and respiratory disease in pigs of any ages. Then, next is vesicular stomatitis. So vesicular stomatitis is produced a diseases clinically indistinguishable from a foot and mouth disease, FMD, and therefore is of a great importance. So it is a viral disease of livestock transmitted primarily by biting flies and midges. The disease results in characteristic vesicular lesions that can occur on the muscles, lips, tongue, ear, chest, udder, and ventral abdomen, and or coronary bands. That would be all, and the next reporter will continue our topic. Thank you.